our national president, Dr. Chhabra, is a renowned orthopedic surgeon. He is more than 20 years of clinical, academic and administrative experience. Apart from MS Ortho, he has done postgraduate certificate course in hospital management. He is a chairperson of many committees, member of many governing bodies and committees. He has peer reviews, publications in many journals. He has written chapters in textbooks. He is faculty for 5 courses and organized many conferences and camps. His dedication and contribution to strength ANBAI is highly appreciable. Under his leadership, the ANBAI is working in systematic way. He is instrumental in motivating, encouraging all state chapters to provide best teaching programs and to solve the problems faced by the institutions. He has conducted National ANBAI Conclave at Delhi recently in an extraordinary way. Please, sir, give your address.
Thank you, Dr. Lingai. Respected Dr. Avidar Sid, Professor Meenu Vajpayee, dignitaries on the dais, and dear colleagues. So it was touched upon what is the importance of our meeting and getting together here today. I think it's a milestone day here for Rajasthan, and it's a big achievement. See, India has been progressing very rapidly economically. You are all aware about the significant growth that has taken place in the last decade or so. However, we will all agree that the health industry is still at a crossroad. Right? With the economic development, the demand for good medical services has increased substantially. However, have we been able to provide the necessary number of postgraduates in the country as such or not? That is a million-dollar question. You are aware that demand of postgraduates abroad has also been increasing very rapidly, and that is one of the reasons why attrition in most of the hospitals in India has also been very high, because people shift very quickly abroad, and we have had a brain drain as such, though there is a trend towards reverting it. They did a study and found out that the 10 most common causes of death in India can't be treated by MBBS students only, MBBS doctors only. You need postgraduates. And if you look at the number of postgraduates in the country, in developed countries, the ratio between undergraduates and postgraduates is 1:1. Whereas in India, it is almost 2:1. So only 1 of 2 undergraduate is able to do a post-graduation. So nobody can deny that there is a dire need to increase the number of post-graduation seats in the country. And the National Board of Examinations has been working substantially to improve the situation in India. I think they have increased the number of seats by more than 2-fold over the last few years, and have been introducing new post-graduation programs, and also new ideas coming out very strongly with various endeavors in order to improve postgraduate medical education in the country. However, there is a need to pool resources, and when there is a need to pool resources, it is on us, all the professionals, all stakeholders, all professional associations, all healthcare facilities to join hands with National Board of Education and Medical Sciences to improve the post-graduation in the country and take it forward. If I am right, there are around 70,000 hospitals in the country, and of these, 43,000 are private institutions. So we can't just leave postgraduate medical education on the government hospitals. The private hospitals have a big role to play in this regard, and that's how the gap which is there can be bridged substantially. So there's a need to introspect. There's a need to introspect how we can enhance private sector participation in not only postgraduate but also undergraduate medical education, and I think a lot is being thought in this regard. But we also need to look into what are the main challenges in this regard. What are the challenges for private hospitals to provide postgraduate medical education? We need to not only look into increasing the number of post-graduation seats, but as we increase the number of post-graduation seats rapidly, are we able to maintain the quality of the post-graduation education is also what we need to look into significantly. And it is here where all of us can play a substantial role. And it is here where Association of National Board of Accredited Institutions can support and join hands with NBMS in this regard. And hence the importance of a state chapter in each state across the country for ANBAI, and hence the importance of today's launch of the Rajasthan chapter of ANBAI. So here I would want to compliment all those involved in conceiving the idea and in taking it to a logical conclusion. So Dr. Balaraju talked about what ANBAI has been doing. So of course, in addition to try to look into various problems of its member associations, it has been also working in a big way in capacity building through webinars, training programs, publications, and trying to improve healthcare quality across the country. It has helped introduce communication skills into the healthcare curriculum, and it also contributed towards the national education policy led by Dr. Kasturi Rangan. Recently, there was a lot of UN cry about with the government to address violence and try to sort this out. We had various webinars to discuss this in this regard. ANBAI has also worked on increasing the number of postgraduate medical seats across the country. But two of the very important things that ANBAI also had a big role to play, as taught by Dr. Balaraju, was MD, MS degree advocacy, whereas the equivalence of DNP seats with MD/MS was lobbied for very aggressively, and also preservation of autonomy of the National Board of Examinations, and had lobbied for it significantly in this regard. So we at National ANBAI have an action plan each year, but this can't be done without the involvement of the state chapters, and hence we request each state chapter also to have a national plan for the chapter, and so that we can engage more and more people for our various initiatives.